In this video, guys, we've got a foreign body removal, we've got an anterior recess removal, and we've got some middle ear effusion. We've got a bit of everything in this one.
Everything in here.
My name is Taylor Green. I'm one of the audiologists here at Audiology Associates.
My name's Rhys, Barber. I'm the other audiologist here at Audiology Associates. So what you can see here, this is my patient. We've got a dry type of wax here, lots of skin underneath it. Yeah. You can always tell they're going to be dry because they're this really pale honey colour. So you always know it's going to be stuck everywhere, and it's going to be a really, really dry piece. So
it does look well oiled though, to be fair.
It does, yeah. I'm not sure whether I put the oil on this one. I think the patients probably put it in before they come along to see me. We always advise olive oil, guys. It's a really good little thing. If you're coming along to have any type of wax removal done, make sure you prepare the wax first. It's much easier for us to get it out. Yeah. Much nicer for you to have it removed as well.
Yeah.
So it's not really budging with suction just because it's an awkward angular shape. I can't quite get the grip. So this is a Jobson horn, this little ring tool that we've got here. We're going to pull this forwards. There we go, out this cam. I'm naming the tools and explaining them, guys, because people may never have, oh my goodness, I'll put my teeth in, may never have seen a wax removal video before, so it's always nice if we can kind of, the newbies, if we can explain everything for them as well, that's always handy. Out that came, really nicely. Let's have a look beyond it. Oh, got forceps in here now. We've got a very thin piece of skin here.
Is that? Oh, I was going to say, is that still attached?
It normally
was. You just, I was going to say, you normally see it like peeling down the ear canal.
There it is.
Look,
look at that.
The tail.
As Taylor said, it's really common to get these ones that sort of disappear off into the distance of the ear canal there. But these long strips of dry skin. There we go. Eardrum looking a little bit on the dull side, but not too bad. Not too bad. You can see very similar here. The other thing you'll get with very dry wax that's got maybe a lot of skin content or keratin content in it is you kind of get these really kind of angular shapes to it as well, do you? It doesn't tend to be that kind of round ball, which is you get with kind of softer wax. Lifting them up. Make sure you stay tuned for Taylor Green's video, which is the next one coming up, guys. That's a really interesting one. That has anterior recess and foreign body in it, doesn't it?
The same patient?
Yeah, same patient. Yeah, really good. So we're just taking these last kind of angular pieces out, these drier pieces. There we go. I know.
That's like the perfect wax removal.
It is, isn't it?
It just literally just slips out straight away.
We've got this very deep piece here, right down in the anterior recess. We're going to lift this one out as well. Oh, it's got a bit stuck. It's a little bit too wide to fit out the ear canal, so we've got to turn it to get it out.
There's a problem when it's quite pointed as well. Sometimes these harder bits are really difficult to get a suction grip on.
A little bit of middle ear effusion there. You can see that line at the bottom, that goldy coloured line. So a little bit of middle ear effusion, a little very dull looking eardrum there as well. Yeah. So we'll explain middle ear effusion a bit later on, otherwise I'll end up talking over Taylor's video, which I do a lot. So 7/8 of an inch.
About 2 centimetres, I would say, just over 2 centimetres.
Perfect. So yours coming up next?
Yes. So there's a bit of a longer story cut short with this particular patient that came in to see myself. Has been back and forth to the doctors, has had sprays for ear infections, and patient historically has kind of mentioned using cotton buds in the past, but not recently. I think this is quite a recent cotton bud, to be fair. It's just a bit of oil that's gone on top of it.
It looks a lot lighter, doesn't it?
Yeah, and you could imagine the patient's face. Husband was sat in the corner, and as I said, oh yeah, this is not wax, this is a cotton bud. So he's like, oh, you just see him shaking his head in the corner.
He rolled in the corner.
I keep telling you not to use them. Now we've removed that bit. Now look at this bit here. So this is, again, down in the anterior recess, really, really wedged in. At first glance, I thought this was just dead skin, which is very common, especially when someone's used a cotton bud and that skin can't migrate. Now, you can already kind of see the color of it is slightly changing now as I'm trying to lift this. I already know at this point it's not skin, but I'm just trying to reposition it slightly so I can get a better grip with the forceps. Because you can see suction is just not really budging this at the moment.
That is wedged, isn't it?
Yeah, this has been in here. This one has been in here for quite a while. Again, you can just see it's just the colour is just completely different, like an ancient cotton bud.
They almost mummified, didn't they, after a while? They got quite hard. So this patient had a cotton bud stuck. which is this one.
Yeah.
And then put cotton buds in again and got another cotton bud stuck.
Yeah. Essentially, yeah.
Okay.
So I've I know. Don't do it. Don't
Stop
do it.
it, guys, please.
So we've managed to like lift a little piece off on the surface, which is going to give me a good grip with the forceps. But it's such an old piece of cotton bud. This bit does actually break away, I believe, if I can remember. But we do manage to loosen it slightly, which is good. I don't think this all comes out in one go.
Don't think it does. I think that's shearing
it's
away.
breaking. Yeah, it's breaking away, and you can see all those little fibres, and you can see all the strands coming away.
That is
Pop
deep,
back
isn't
in
it?
again. Yeah.
Sometimes when you loosen it like that, it will pull it forward slightly, won't it?
Yeah. Now, even removing the first piece of cotton bud, the patient already was hearing so much better, but was hearing a lot better once they cleared this bit out. The patient was actually quite shocked at how clear they were able to hear once I took this out, because they've been having problems with their ears for so long. It really baffles me sometimes how like this doesn't get picked up to start with. I don't know how. I understand tools are completely different.
Yeah.
Our vision is really good with the endoscopes, but look at the size on this piece that we've just.
Wow,
it's
that
like
wasn't even tiny, was it?
It's like a ball and a chain, that was.
Jeez whiz.
But yeah, it looks a little bit dry there, obviously with
Yeah.
a little bit, I wouldn't say on the unhealthy side. Now look at this piece. Now, if somebody was to take a look with what we would call an otoscope or a standard, you can't even see the wax here just looking in here. This would probably be missed.
Yeah.
I got the fine end on here. Now, this is very, very difficult here. We need to try and avoid touching the ear canal. Now, you can see I'm just kind of hovering above it. Now, you'll see here in a second, this is actually... I was quite surprised how nicely this came out, to be honest, because I thought this was going to be a nightmare.
Oh, that's good.
Look at that.
Oh, fair play.
It's quite surprising how much you can store in that little space in the anterior recess there. But even though the patient wasn't really having much issue on this side, this did still feel better, because the patient was sort of explaining that, I can feel there's something there. But yeah, it was quite a tricky one, but at the same time, I was quite surprised how nicely it came out, because those can be a nightmare to try and remove.
Deeply satisfying about getting that grip when you can only just see that leading edge and be able to just lift, and the whole thing lifting up to that is quite satisfying.
Now, we were gonna say about the middle ear effusion.
We were. Yeah, sorry, we were going to go back on middle ear effusion. So. Basically, the space behind the eardrum is filled with air, but there's a tube that leads from that middle ear space to the back of the throat. So bacteria is always trying to get up that tube. It wants to get into these lovely warm spaces and be able to breathe. So what your what your middle ear space does, it's lined with mucosal cells. So they are constantly producing a very thin mucus. So it flushes down that tube every time we yawn, swallow, or chew, and flushes the bacteria into your gut, which kills it off. But what can happen in some patients, especially if you get a cold, you get a little bit of puffiness to the sort of soft tissues at the back of the nose, what you end up with then is that tube can't open and shut. Yeah. That fluid's got nowhere to go, so it starts to back up in the system. And that's why you can see that sort of gold layer sitting at the base of the canal. And you can almost see like a spirit level. You can see a level of fluid there. Sometimes you'll see bubbles in it as well when you're honest. That's the other thing you can see.
And you can get a lot of popping and crackling with it as well. Some of the symptoms can be, you're hearing your own voice in your head quite loudly. You're almost feeling like you're underwater. Sometimes you can hear it sloshing around. As Rhys was saying, very, very common with colds, flus, catarrh, sinus issues. The ones that you were seeing on the videos are kind of the gentler of the two, I would say, because you can get middle ear effusion with kind of an infection as well, which would be otitis media with effusion, which looks quite angry, quite inflamed, quite painful in some cases. But these were the nicer ones. These are literally just blockages.
So it's this what they call acute otitis media. So it becomes so your normal middle ear fusion is sterile. So that just sort of sits there. It doesn't really do anything. It thickens up, but it just reduces hearing. When you've got a middle ear infection, it's acute otitis media. It's just everything's aggravated. The eardrum's distended. It looks white. All the blood vessels come to the surface. So yeah, that's not a nice one. Usually, if you don't get it treated early enough, it will probably lead to a perforation as well. Well, guys, thank you very much for watching the video again today. If you did enjoy the video, don't forget to like, heart, share, follow, and subscribe for us. If you have an ear problem yourself, check out the link tree in the description. You can reserve an appointment with myself or the lovely Mr. Taylor Green. And as always, guys, take care of yourselves.
Take care of your ears.
And take care of one another. And we will, fingers crossed, we will see you again soon. But if not, either I will or Taylor will.
Bye.
Yeah, see you soon. Bye, everyone.
Bye.